Georgians for a Healthy Future identified 3 major policy recommendations through our review of Open Enrollment 2 that would help maximize enrollment and retention into health insurance and help reduce barriers to meaningful access to healthcare services for Georgia consumers. The first policy recommendation is to close the coverage gap in Georgia. More than 300,000 Georgians are stuck in this gap, and it came up over and over again in our interviews with enrollment assisters. There were many low-income Georgians who sought out health insurance and either earned too much under existing Medicaid eligibility levels to qualify for coverage that way, or earned too little to qualify for tax credits and left without any coverage. 30 states around the country have closed their coverage gaps, and this is something that we encourage Georgia policymakers to do as well. The second policy recommendation that we identified is to set and enforce network adequacy and transparency standards. One of the themes that emerged was that consumers who enrolled in health insurance felt that they didn't have the information that they needed at the time they enrolled to determine whether the provider network was narrow or broad and exactly which providers were in their network. It turned out that many of the provider directories were inaccurate and consumers did not have the information that they needed. So we encourage policymakers to increase transparency of provider networks and to set and enforce network adequacy standards so that all consumers can have access to the healthcare services that are covered under their health insurance plan. The third policy recommendation we identified is to encourage the use of public-private partnerships to help facilitate education and enrollment for consumers. There were a lot of powerful partnerships that were missed because many either governmental entities or community organizations, out of either caution or out of confusion, opted not to participate in enrollment-related activities, and that's really because of the restrictions that were placed on them by the Healthcare Freedom Act and House Bill 943 in 2014. So we would encourage policymakers to repeal that language and encourage better partnerships between community organizations and state and local governmental entities. To learn more about our policy recommendations and findings from the second open enrollment period, check out our Getting Georgia Covered report. You can find the report at healthyfuturegA.org.